An RA flare feels a lot like the first diagnosis of RA. So patients start to develop pain, swelling, stiffness. The stiffness is especially in the morning, and it can last hours to maybe several hours or even a whole day. A rheumatoid arthritis flare is an acute activation of the immune system such that the joints become inflamed, painful, and difficult to move. Flares can go on for several weeks without appropriate therapy. The immune system is very mysterious, so a person can have a flare without any sort of trigger, but there are certain things that trigger flares, such as stress and infections. Sometimes patients get frustrated if they're taking their medications as prescribed and they still have flares, but it's important to note that flares can happen even in patients who are completely compliant. Unfortunately, some patients will break through their treatment and end up having flares, but we like to tailor the treatment plan such that we minimize the number of flares as much as possible. So if someone is diagnosed with rheumatoid arthritis and they believe they're experiencing a flare, they should certainly see their physician as early as possible in order to get therapy and get the flare under control. The first thing is to assess how bad the flare is. So we tend to use medications that work quickly to reduce inflammation. So steroids are one of our tools, but some flares are a little bit milder and we can get away with non-steroidal anti-inflammatories, such as ibuprofen or Aleve. And then it's important not to try to push through a flare. So take some time out if you need to take some time off work, or maybe reducing the numbers of obligations you have in your life to really care for yourself and have that rest in order to improve your flare. Because these disorders tend to come and go, it's very tempting to stop taking the medication when you feel well. And if you want to avoid having flares, you really need to take it all the time. Adequate sleep, adequate exercise, not overexertion, and stress management are keys to preventing flares.